Dr. Thomas Dobbs is telling hospitals across the state to activate what is called their surge capacity plan. In essence, that means creating more bed space to deal with this onslaught of new COVID-19 cases. But here at UMMC, they say that's already a challenge when they're already full.
We may be at crisis standards of care within the next several weeks if we're not careful. And what does that mean? It means it's a little bit different healthcare system. It's putting people in open wards. It's doubling up rooms. It's housing people in places that they don't normally stay.
Tuesday, another record-setting day for COVID-19 cases in the state of Mississippi, and health officials warn these are people who likely got infected weeks ago, a signal that the worst is far from over, and state hospitals need to add more beds now for what's coming.
If we don't see a decrease in transmission immediately, then it's pretty likely that the healthcare system is going to be thoroughly overwhelmed.
The latest numbers from the state health department as of Monday show a stark increase in the number of ICU beds being used in the state. June 20th, 18% of those beds were being used for COVID-19 patients. But as of Monday, the number nearly doubled.
Can you add more patient bed space here at the hospital?
We do have the option in several areas of adding bed space, but when we think about that, we also have to think about, we would need more physical equipment, beds, monitors, that type of thing.
Dr. Alan Jones is the Assistant Vice Chancellor for Clinical Affairs at UMMC, who says it's not just a matter of clearing out rooms, but having the nurses, medical staff, and key equipment needed to deal with additional patients.
And they say it's not just a premium for medical staff. Right now, one of the biggest challenges is having to have places where you can ship other patients when states have hospitals that are already at capacity. Live in Jackson, Scott Simmons, 16 WAPT News.